one's in front of you.
I'm just saying, like, how thick it is.
Yeah. Finally made it to Houston. My God, the traffic was horrible getting here. The dense fog was horrible. It was just not a good day to drive into Houston today, but we're here. And so we'll keep you updated as soon as he has his appointment. We'll let you know what's going on.
Do you want to see which one it was the last time?
Yes, what was last time?
It was 288.
So you gained weight.
Yeah.
So it looks like they're going to schedule surgery for him. The doctor's going to come in a little bit and just let him know the details. So wish us luck. Just want to give you a quick update. See what it looks like. It's gotten bigger. But let's hope for the best that surgery will be able to remove it and get the help he needs and move on with their life.
Get my evil twin brother out of my face.
Yeah, you guys can see it's like coming up from this side too now. At first it was only on this side and up on his eyebrow area. Yeah.
And the other surgeons that kind of work on the head and neck and what we call, from neurosurgery perspective, we call the skull base. You know, it's technically, you know, it's on your under your face, right under the skin on your face, but behind there, behind your eyes, is what we call the skull base. And so that's why we get involved. It's because it's kind of part of the head, and so the ENTs and everyone like to have us involved.
Yeah, because not only they discussed it about it being really close to the brain.
Close to the brain, exactly. And so that's why neurosurgery gets involved. Okay, nerves and brain and things like that. That's when we get involved. Okay. And so I'll do like a quick exam with you and kind of confirm everything that's going on with you, and then Dr. Roz will come see you and talk to you kind of about the surgery and what he would do. Okay. And you don't have new imaging. Last imaging was like a month ago, right?
Yes.
But the last MRI was 2 months ago. Okay. And then, so you're scheduled for the MRI repeat today, it looks like. Is that right?
I have no idea. I didn't know about
Oh, no. It says it's happening, today's Tuesday, Thursday? Does that sound right?
The 26th.
Oh, I see the 25th.
Oh, see, that's new.
So I don't know. But then it says scheduled, ordered today. Oh, Mariella ordered a new one for you.
Okay.
Okay, so the 25th. And then,
So we have to find a hotel for a couple of days. We didn't bring in.
where do you live?
We live in
Austin.
Oh, okay. Maybe we can get you in today. I don't know.
Yeah, that'd be cool.
Yeah, so we bought only one set of clothes
Or
just in case.
we can schedule it, you know, closer to the surgery.
Even tomorrow, we'll be here tomorrow.
And you're getting a colonoscopy here?
It says on June 7th.
Okay. And then you're supposed to get chemo, but they canceled it because it
wasn't working.
Okay.
So it looks like he's going to have surgery. Just trying to get everything in order. They scheduled him an MRI today around 11:15. Hopefully we can make it because we have to talk to another doctor. But it's either going to go through the nose surgery or they're going to have to do the nose and then do surgery, cut him around his head area, and then to pull it down to take it out. They're still discussing the clinical trial, but we'll see what happens then. How are you feeling, babe?
Oh my God, I'm nervous and stomach is like I'm nervous.
I just sort of want to hear from the two of you in terms of what's been explained to you so far about what's going on.
It's brief, a little bit briefness. Like we've already found out today that I'm gonna get surgery. We didn't know until today, and that's probably about mostly it.
Okay. Now I'll sort of fill in the details a little bit, but I just wanted to hear from the two of you. You know, while on the chemotherapy, I guess how did you feel like the fullness between your eyes was looking? Was that, I heard a little bit that perhaps you thought that was getting better while on the chemotherapy?
It felt like it got a little bit better, but it looked like it got like a little bit whiter.
Okay.
It actually kind of like shrunk as far as thickness, but it feels like it went whiter.
Well, okay. Gotcha. And then the nosebleeds, they'd sort of always been there, or you think they got worse a little bit?
I think they gotten worse since my chemo.
Okay.
It happens periodically.
Okay.
Like I was saying to the other doctor before you, when I cough, like I've always had a real bad cough.
Okay.
And when I cough real bad, it'll start bleeding.
Okay.
It'll be like kind of like not like a water faucet, but it'll come out pretty
It's
bad.
whenever he strains even to lift something down. He's
Okay.
like leaning down and trying to pick things up. It's when it happens.
Okay.
It's like it's the pressure.
Gotcha.
Also, like I noticed after chemo, the top of his eye got a little bit more, because it was more pronounced over the eyebrow, and also his bulge in his eye was more pronounced. And after chemo, maybe a week after, we noticed it had gotten a little softer around this area and on the eye portion, but it had shifted down to the bottom, to where it's at right now.
My eye was kind of more
Swollen. Okay.
yeah.
Well, let's talk about what's going on here. Hey, pull up your scans here. Sorry. Now, I'm sure Dr. Hanna and Dr. Ferraro had explained to you, in terms of treating cancers in this area that, really imagine the brain sits on a bony floor called the skull base, and that's sort of like the first floor of your house. And what sits in the basement is really the nasal cavity, the sinuses, and the eye sockets. And your tumor began in that compartment and then went up through the bone and went up, to involve the envelope around the brain. And depending on the specific diagnosis, we usually talk about starting with chemotherapy, then depending on the response, if it responds, keep on going with it. And then depending on the final response, we discuss surgery and then, more chemo and radiation therapy afterwards. If we're in a scenario where we're worried about, getting chemotherapy is not working as well, then we discuss sort of skipping the chemotherapy and going to surgery. And I think there were perhaps some symptoms that you were having that may have been concerning that perhaps the tumor is growing, but then in hearing you today, some aspects it may seem like the tumor had actually responded. Ultimately, I think we need some objective data. So that's why we have you scheduled for an MRI scan today, because I want to get that to sort of figure out what are the next steps. So I'll briefly sort of show you your scans here, and then definitely want to get you to your scan, and sort of we'll talk about what happens after that scan is done. But this is your MRI scan from March 21st, taken as if you're looking straight back and we're slicing back. Top of the screen is the top of your head. Eyes are here, and your nose is coming out of the screen here. Left and right are flip-flops, so the right side of the MRI scan is the left side of your head. So this is your eye right there on the left eye and your right eye. And then imagine your nose coming out here. This is your tumor right here. So anyways, this is where you were in March. And what we'll do is we'll get the MRI scan today. If we're worried that the tumor has grown despite the chemotherapy, then the plan is to go ahead with surgery. And certainly, Dr. Hanna and I will talk to you in more detail about that. My feeling is that the tumor looks about the same on the scan today. We can talk with Dr. Ferraro perhaps about continuing ahead with the chemotherapy a little bit. So let's sort of see what that step is. If it comes down to surgery, I'll talk to you in more detail about what that surgery will consist of. Okay. Initially when we were set up to meet today, the concern was that you really have grown, the tumor's grown despite the chemotherapy. What I'm hearing today, though, is that there's some aspects of this that seem like they've responded.
But it was very mild.
Yeah.
Because she said that it should have melted away.
Okay.
That we should have seen a dramatic result from it.
Yeah.
And it wasn't there.
Yeah, and it was just one cycle of chemotherapy.
It was 1 day with 3 cycles,
Okay.
3 treatments.
One day with.
Yeah, I had, it was Friday, Saturday, and Sunday. I had the first one was 8 hours, and the second two were like four
Okay.
4 hours.
Gotcha. Well, let's see what the MRI scan shows, and we'll take it from there. You know, if surgery is to be done, the way it works is that Dr. Hannah and I would remove the tumor completely, and the thought is that we want to get negative margins, so to remove all the visible tumor but clear all the microscopic margins out. And so it's a combination of 2 different surgeries that we do in the same day, where Dr. Hannah would make an incision perhaps along your left side or along the right side between your eye and your nose to remove the bottom portion of the tumor. And then what I would do is do an incision that goes from in front of your ear on one side over the top of your head to the other side. But create a very limited opening in the bone right here so I can sneak in underneath the brain to remove everything else.
That's the one kind of freaks me out.
Yeah. Well, luckily people recover really well.
Okay.
So because also the nature of my surgery is dependent on what that scan looks like today. And I definitely want to talk to you in detail about what that surgery would look like.
Okay.
But let's have the updated scan for that. So what we'll do is this: is we'll get the updated scan today, and then Dr. Hannah, Dr. Ferrarato, and I are going to discuss the scans by the end of the day today, and then we should finalize the plan. If we're looking ahead at surgery, then Dr. Hannah's office is going to coordinate the surgery.
Okay.
And then I'll, meet with you. I can do a video visit, for example, next week or the week afterwards to discuss exactly what the surgery will consist of.
Okay. Just the process of opening my head that way is like scary to me. But I know I'm in good hands. But
It's a lot to go through.
yeah.
I promise you, people recover well from that operation.
Okay. It just kind of freaks me out.
Yeah. But the goal
I know
is
it's gonna happen one of these days. So.
Yeah, the home run, right? The goal is to treat you so you don't have to worry about this tumor as long as possible, to make sure your brain is working fine, and that you're able to enjoy all the fun things in life. We're going to get you to that.
Thank you.
Sound like a plan? It's a deal?
Sorry.
No, don't apologize.
You're gonna be okay.
Yeah, I knew it was gonna come. It's just emotional.
Yeah.
Sorry.
No, don't apologize.
I know it's scary. We done our research, so we know pretty much what the surgery looks like, what it entails, and
It's one that patients recover from really well. I mean, when you look at folks, 6 weeks out, they're ready to go with radiation therapy. Look at sort of brain function. The risk of affecting your brain function is less than 1%.
Okay.
So it's one that people recover from. While the incision seems large, cosmetically it heals really well too.
Okay.
So it's, of course, any type of surgery is scary to go through, right? But if we're recommending surgery, it means that it's one that people do well with, and that's the reason why we're recommending it.
and the recovery time from the surgery.
So it depends a little bit on the closure
Okay.
also. In talking with Dr. Hannah this morning, at least based on the MRI scan from March, we may need the plastic surgeon's help to close essentially the incision that he's going to do. And essentially the bone along the upper part of the nose, there's tumor there. So when he's done removing that, there's going to be an opening there underneath the skin. So the plastic surgeons likely will have to take some muscle from your leg with the healthy blood supply to use that to fill that space underneath the skin there.
Okay.
So that affects the recovery. It's because of that ends up being 5 days in the hospital with the intent that you're being discharged home safely at the end of those 5 days. Recovery takes about 6 weeks for you to get back to the point where you feel like, okay, you fully recovered from surgery. From this portion, people are ready to leave the hospital 2 days after surgery, and they're back at work within about 3 to 4 weeks. So recovery ends up being pretty quick.
Okay.
Because his job is pretty physical, but they've been keeping it easy on him.
Yeah, what I would say, and what do you do for a living?
I work at Walmart in the automotive department.
Okay.
I'm the manager over there.
Gotcha. So I think, recovery-wise, one, there's an aspect of going through surgery, right? And it's going to be several days of appointments leading up to surgery, the surgery itself, 5 days in the hospital, and then for 6 weeks really taking it easy, recovering at home. Then around 6 weeks after surgery, we're going to be talking about doing radiation therapy. And so you're looking at really the next 3 months around or so of like treatment sort of consuming your life a little bit.
Okay.
And certainly any paperwork that's needed as we get closer to surgery, either Dr. Hannah's office or my office can help take care of it.
Yeah, the FINLA. I think we handed them to one of the nurses, right?
Okay.
Yeah, a couple weeks ago, so they have
Okay.
all my
Paperwork, I guess.
Paperwork, yeah.
So I guess you automatically just continue sending it to
Yeah,
them.
exactly.
Okay,
So
that made me feel better. It was just thinking about the after recovery, that was kind of freaking me out. But
Yeah.
it said, people will recover pretty fast, so that made me feel a little bit better.
Yeah, because we're in the process like not renewing our lease and staying with family or moving here to Houston so he can be closer to the treatment
Right.
center.
yeah, definitely. I think the next several months are going to be intensive here in Houston, and then once we get you through surgery and radiation on the flip side, then sort of your time frees up a fair amount.
Mm-hmm.
So yeah, just giving you sort of realistic expectations. It's of course the recovery from everything, but just the timeline of everything that we look at.
Mm-hmm.
I want to have to call it extended stay so you can stay here for 3 months.
Yeah, we can. That's with the. I think it was the American Cancer Society,
Or even so we can get in with the
Hope Lodge.
Hope Lodge. So we've been trying to get into Hope Lodge, but every time they're like, oh, we don't have no openings, and that's what's kind of scary also is like, because right now, we don't have anybody that lives here in
Yeah.
Austin, in Houston that we can stay with, so we're trying to get hotels and.
You should reach out to, and I can have, just gonna send a message to social worker for Dr. Hannah's clinic.
Mm-hmm.
If you just reach out to Katie's to have you, Dr. Hannah's PA,
Mm-hmm.
just reach out to her saying if she can connect you with their social worker, or the social worker can help.
So family and friends, we got scheduled in at the very last minute. We got lucky that they had an opening for MRI because, as y'all guys heard, he is going to have surgery, but it all depends on what this MRI says. And so it looks like we're gonna stay an extra day here in Houston, just to make sure that he doesn't have to come back for any reason tomorrow. And this MRI is gonna last maybe an hour and a half or more. Right, they want to get together, look at it to schedule surgery, and then after surgery, radiation. And it all just depends on how things go after surgery, even maybe chemo, but we don't know yet. So we're just waiting to see.